And you don't want to find yourself needing a level 1 trauma center. And here's just some of what they have to deal with. Look at this list.
Yeah, we're talking about traumatic car crashes, traumatic brain injuries, blunt force trauma, gunshots, stab wounds, serious burns, or serious falls.
The decision to close Wellstar AMC will put a larger strain on busy Grady Memorial Hospital. As we mentioned, Grady is the only other level 1 trauma center in Atlanta, but they already run over capacity daily. We talked to Grady's CEO today about his concerns for patients.
We are not concerned about our ability to absorb that urgent emergent care, but we are very concerned about how the additional volume into the main emergency room will begin to clog up the process of getting patients in and out.
In April, Wellstar closed the emergency room to their AMC South Hospital, and since then, Grady Hospital says they've seen a significant increase in ER visits.
Well, healthcare is not cheap here in the U.S. We all know that. Even if you have private insurance, it's still very expensive, but a lot of people can't afford that. Atlanta Medical Center was part of a nonprofit, and they were able to help.
But with AMC shutting its doors, many patients feel they've been hung out to dry. And this is not just a small number of Georgians. Take a look at this. There are nearly 1.5 million uninsured Georgians. That is a 14% increase of all Georgians. CBS 46's Crystal Bowie sees how the community is still reeling from the news.
A change like this one is going to be affecting those coming into Atlanta and expecting to have even more health care options. But now they're about to have one less. Banners hung by Wellstar Health System's Atlanta Medical Center, proudly saying 100 years in the old Fourth Ward, caring for Atlanta. But now that 100-year run ends on November 1st.
This closing can potentially be devastating.
Paul Poston is one of those people devastated.
They shouldn't. Everybody needs a doctor. And so where they go? Where they gonna go? Nowhere.
His daughter was born at AMC in 1986, and the hospital is just a few blocks away from where he lives. But now he'll pay additional costs, including to commute to other hospitals.
What are people gonna do? Where they gotta go? The other side of town to go to the doctor and stuff? I don't think it's right.
Healthy Future Georgia says AMC serves predominantly low-income and patients of color, including many who are uninsured. There are over 200,000 people in Fulton and DeKalb counties who are uninsured. 66% of uninsured residents in the two counties are Black. That's according to the data compiled by Georgia Rural Health Innovation Center.
Takes away one additional healthcare resource that they would have had access to in case of emergency or in case of illness.
Georgia Watch, an advocacy group, says this loss will be felt throughout the state.
We are concerned for doctors, hospital staff, and nurses that are already experiencing long wait times.
Wellstar sent out a message to its employees saying that over the course of the last 12 months, they have lost $107 million in operational costs. Reporting in Atlanta, Crystal Bowie, CBS 46 News.